Hello students, this is Perio, Chapter 33, Lecture 1. Abscesses of the periodontium. An abscess is an acute infection involving a localized collection of pus in the periodontium. An abscess of the periodontium is circumscribed, which means it is confined to a specific site, such as the facial surface of a single tooth. The image on the right shows an abscess of the periodontium between the canine and lateral of the mandibular right side. The patient may present with symptoms of pain and signs of swelling of the gingiva. The patient may also complain of difficulty in chewing or a bad taste in the mouth. Remember to distinguish between symptoms and clinical signs. Swelling is a clinical sign. Elevated body temperature is also a sign that the abscess of the periodontium may be spreading. So this is a serious sign if it's present. When doing the clinical exam, you will see a circumscribed swelling of the soft tissue, which may involve the gingiva only or both the gingiva and the mucosa. The tooth affected by the abscess may present with temporary slight mobility. Radiographic exam will reveal alveolar bone loss in the area of the abscess not involving the apex of the tooth. Teeth affected by the abscess will be vital. The collection of pus may break through the surface tissues. Here is an image of an abscess that has broken through the tissue. Blockage of the opening of an existing periodontal pocket or forcing a foreign object into the supporting tissues of a tooth can cause an abscess. The common culprits are toothpicks, improperly used. Popcorn husks are big factors. And also if there was calculus removal which was incomplete and then the tissues closed around it, that could also lead to abscess formation. Clinical recognition and diagnosis is very important, and it is important to distinguish between a periodontal versus a periapical abscess. The abscess of the periodontium is an acute infection of the periodontium, whereas a periapical abscess is caused by pulpal death, and the tooth will be non-vital. Abscess diagnosis must differentiate between these two types. The image on the right shows the characteristics of each one. A gingival abscess may occur in a periodontally healthy mouth when a foreign object is forced into the sulcus and will be limited to the gingival margin. They can occur at a site with pre-existing periodontal pockets. In this case, they will usually affect deeper structures of the periodontium, and they are not limited to the gingival margin. Treatment of gingival or periodontal abscesses require the establishment of a path of drainage for the pus, a thorough periodontal debridement of the tooth surfaces in the area of the abscess, and control of discomfort. The previous statement regarding the location of gingival or periodontal abscesses will be different if a popcorn husk is involved, as they can dissect through the periodontium and shows pus and swelling in deeper areas despite the fact that the patient did not have periodontal disease at the time. A pericoronal abscess is an abscess of the periodontium that involves the tissues around the crown of a partially erupted tooth. The flap of tissue is referred to as the operculum. In this case, the extraction of the impacted tooth is recommended. Necrotizing periodontal diseases are acute infections of the periodontal tissues that involve tissue necrosis, in other words, localized tissue death. These periodontal diseases are divided up into NUG and NUP. There is insufficient evidence to establish if NUG and NUP are two unique diseases or different stages of the same disease. Necrotizing periodontal diseases appear to be related to diminished systemic resistance to bacterial infection. Distinguishing characteristics of necrotizing periodontal diseases. They are noticeably different than any other periodontal disease. They involve necrosis or death of the cells comprising the gingival epithelium, ulceration or loss of gingival epithelium, normally covering the underlying gingival connective tissue. There's also a gray-white pseudomembrane present, and punched out papilla are also present. This is an image of a patient with NUG on the left and on the right after treatment of the NUG was successfully completed. The typical treatment for NUG includes, at the first appointment, a gentle removal of the pseudomembrane, limited supragingival instrumentation, self-care instructions restricted to removal of debris with soft toothbrushing, chlorhexidine rinses twice daily, or they can also use equal parts of hydrogen peroxide and warm water every 2 to 3 hours. At the second appointment, 2 days after the initial appointment, subgingival instrumentation can commence, and the patient can be given further self-care instructions. The third day appointment is scheduled 5 days after the initial appointment, and you can at that point complete subgingival instrumentation. The patient may require antibiotics. The fourth appointment is following the resolution of the infection. At that time, a comprehensive clinical assessment is made and identification of any underlying chronic periodontal disease is done. The distinguishing features of NUP are similar to those of NUG. They affect deeper structures of the periodontium, including the bone, and can be accompanied by the formation of sequestrum, which are fragments of necrotic or dead alveolar bone. Treatment of NUP is very complex and must be referred immediately to a periodontist. They may also require medical consultation. Primary herpetic gingivostomatitis is a painful oral condition that results from the initial infection with the herpes simplex virus. In most patients, the initial HSV infection produces no noticeable clinical signs and goes undetected. In some patients, however, the initial infection produces very severe oral symptoms that are known as primary herpetic gingivostomatitis. This child has only a single herpes vesicle on his tongue. This child manifests widespread labial lesions. Note, the fingers of the hygienist are not protected and she may get herpetic whitlow. This child shows a severe infection with lesions that extend to the face. Primary herpetic gingivostomatitis is contagious and requires careful attention to prevent its spread. This concludes Perio Chapter 33, Lecture 1.